It's too bad that the government has to tell these people to do it. They shouldn't be. They should have been doing it on their own. Now, so they also said that what's called the medical loss ratio. That is that in the past, whatever money that's saved was taken as administrative costs and profits. Now they said, no, you can't do it. It has to be 85% of the money has to be given out as the claims or medical care. It can't be more than 15 to 20% as administrative costs. So these are all good things, and he's going to create health insurance exchanges. It's going to be a lot of growing pains, but there are some principles put in place that for the first time are trying to address the issues that have not been addressed for 50 years. So that's the thing that people have to give him credit. He really took it, and he almost, in 2010, he lost the House because of this, because the Tea Party came into just anti-Obamacare, and they were successful. And he was given employer tax credits, employee subsidies, and electronic health records. He's giving incentives for doctors to say, guys, this is freaking 21st century, man. Don't be looking at a paper anymore. We got to look at electronic health record that can talk from one hospital to the other eventually. I've been doing this electronic health records for 7 years. We were the second practice in Flint to do it. It is good. It's time we all go into 21st century, right? But people are always opposing a lot of things depending upon their interests. But he was actually giving incentives and accountable care organizations. This is a budding or a nascent idea where they're telling doctors, you know what, we're not going to pay you for fee-for-service anymore. That means the more you do it, the more you get paid. We're not going to do that. We're going to see how you are managing the disease of the patient and how their health is over a period of a year for a certain population, and then we'll pay you a certain amount of money. You do a good job and save money, you keep it a certain percentage. If not, well, you pay the rest of the expense. Now, government should be telling us, we should be doing it in the beginning. Do the right thing, really what's right, what's not necessary, don't do it. But all these principles are in Obamacare. So Ryan says, we can control Medicare costs. And we got to fix the costs. And the way he wants to do it is to have premium assistance, which is called voucher or whatever you call it. But what they're doing is the $5,000 per year they'll give. And if it costs more than that, well, how is that going to be paid? Either the patient has to pay because the insurance company is not going to pay. And he wants to give these vouchers to private insurance companies. Right now, Medicare does not make profit. It's the only system in America, healthcare delivery, that does not make profit. It takes money as payroll taxes, and it is, because it doesn't take profits, it is the most effective and the least expensive administrative health delivery system in America. It costs 3 to 5% to deliver Medicare, as opposed to 20 to 30% for private insurance companies. Why? There are no insurance agents going for a commission, all the advertisement, competition, none of that is there. So, and by the way, Ryan also wants to cut Medicare first, but doesn't want to do anything for defense. So people are saying, no, wait a minute, let's take care of people first, not spend money on wars, especially something like Iraq, which is $1.6 trillion, unnecessary war, 6 years worth of Medicare. This book, so can we really fix the problem? Well, to really fix the problem, you have to understand the root cause that's perpetuating the system. So this guy, these two people, Patrick Rooney and Dan Perrin, were conservatives who came up with health savings accounts idea when Bush was in power. And they wrote the book, and this page is from that book. The problem is greed. The ship has lost its moral rudder. It's awash in greed. The money is too easy and the greed too strong. That's where the problem is. So even though I said, can we reverse all the things I said are responsible for the system? Yes, theoretically it sounds easy. Practically very difficult. Why? Because the American healthcare system is like any other American business capitalistic system. Clearly healthcare in America is a business, and the business of business is profit, and America's business is business. So the philosophy has to change from business to service, and that's the bitter pill, and it's not going to be that easy. You got to start with the philosophy. Well, are we going to call this a health is a human right, or is it a privilege? Well, that's where it starts. Once upon a time, when people said, slavery is bad, well, it was abolished after that started as a philosophy. But until that time, it was accepted. Until 1920s, women were treated as second-class citizens and said, you can't vote. Well, somebody said, no, that's not correct. The philosophy changed, and now so all these things start as an idea and philosophy. So mind is everything, what we think we become. So the society is the same thing. Our politics and laws are a reflection of our mind as collectively as a society. So we should first start thinking, well, do we deserve a basic universal health care system in this country is what we have to start thinking. And then we can say, well, how do we get it? I like this saying, of all forms of inequality, injustice in healthcare is the most shocking and inhumane, because health is wealth. And if you're not healthy and you're sick, it doesn't matter how much money you have, you're sick. You know what I mean? You can't be happy and you can't enjoy. All these countries have done it already. It's not that it can be done. All these countries have done it but through three systems. Two-tier system, which means that you have basic universal health care for everybody, but beyond that, some special perks and privileges you have to pay for, either through out-of-pocket or buying insurance for that. France is like that, Australia is like that, and some other countries mandate that you must buy insurance. For example, Netherlands is that, Germany is that, but single payer, which is that the government takes money as taxes and then provides health care, and they decide all the basic health care as far as what can be given. And Sweden and England are examples of single payer. So there are systems available. We just have to decide if we want to do that or not. But in America, there are already two single payers that are in play. Veterans Administration is a very effective, these days highly liked by the veterans, single payer system. The money comes from Veterans Administration. The veteran goes in, doesn't pay $1 or pays very minimal. He gets all the care. And as he said, a few years ago, some other doctor said, you know what, this guy who is a veteran is going to be with me till he dies. So if I don't want to see him too many times, I want to make him as healthy as possible by preventive medicine. So, and integration of all the services among all the different fields of medicine. So they apparently went to Radio Shack and got some computers and all the stuff together and created the first electronic health records. And there's a guy who wrote a book called VA for All. He's a conservative economist, so impressed by how effective the system was and how happy the veterans were. He wrote a book called VA for All Americans. And Medicare is the other example. 100% of seniors are covered. 100% of seniors are covered the moment they're 65. And their satisfaction with Medicare is very high. In fact, it's so high that even Tea Partiers said, I want government to take their hands off my Medicare. I'm like, wait a minute, I love that. Every time I see that sign, dude, do you know Medicare is a government program? But I love it. That is now the irony and the reflection of how much people love Medicare. And as a doctor, I don't have to, I get paid less by Medicare, but I don't care because I don't have to worry about, authorizations and all that stuff. But Blue Cross Blue Shield pays a lot more money, but you know how they're able to pay me that money or pay more money to the hospital? They charge the hell out of you guys. That's why the premiums are so high. So for me, I am okay with getting less money from Medicare as long as it cuts the burden down for all the American citizens. I have no problem with that. I can't complain as a doctor. It's a good profession as far as the economics are concerned. But a lot of doctors are unhappy. I'm like, come on, dude, you have enough. So when you say, when you don't know when to say enough is enough, of course you're going to hit Medicare. That's why Obamacare passed in the American Medical Association 51-49%, just barely. How can we bring the system to be different? I think doctors should take the lead. Doctors should really take the lead. When Medicare, actually 1930s, when workmen's compensation was created, because there were some really conscientious citizens that said, wait a minute, we have employees getting hurt and the companies are not caring, so we got to have compensation. So they went to states and they one by one, they created workman's compensation. So they were so encouraged by this, they said, okay, now we can make a national health insurance program. Well, little did they know that there were a bunch of doctors who were going to hate the system because they didn't want government to get involved, because they was going to regulate them or tell them how much money they can take. So apparently the doctors charged $25 to every doctor's member of the association to defeat this thing. So doctors, like anybody else, of course, are selfish, right? When Social Security was about to be passed, 1930s, FDR wanted to include health insurance for seniors. Doctors said, well, you put that in there, we're not going to support Social Security. So that was taken out. 1960s, Medicare, well, guess who opposed Medicare? Doctors. But Medicare was the second most important step in America for healthcare costs to go up, because suddenly a lot of capitalists and enterprising businessmen realized, wait a minute, government is going to put billions of dollars in healthcare. For the first time, for-profit hospitals, for-profit diagnostics, physical therapy, nursing homes, everything was created because of that. And that's where the profit margin is added in every step of delivery of healthcare, and that's why the healthcare is as expensive as it is. But the most important people are going to be the citizens. They have to participate to bring change, because the politicians are not going to do it, because they're absolutely under the control of the pharmaceuticals, the health insurance companies, device manufacturers, and some doctors. So they have to bring it out. Now, John Locke, whose philosophy is the base of American Constitution, said it. If your representatives who you elected to provide security for you and expect you to do the things that you want them to do, and they're not doing it, it's your responsibility and duty to vote them out of power. So it's in the hands of citizens to bring the change. And that's why this girl is saying to her representative, you got to work on healthcare for all. Now people may say, dude, that's dreamy. It's not going to happen in America. Well, let me go back 1 minute as far as the doctor's role. There's a program called Physicians for National Health Program. It's created in, located in Chicago. 15,000 doctors and non-doctor members. They're all for single payer. So a single payer is a system where the people pay into taxes, and then everybody is taken care of through that fund. No middlemen, insurance companies, and all that stuff. So in 2011, Vermont passed for the first time in America a single-payer law. It's not a true single-payer yet, because not all the private insurance companies eliminated yet, but it's the first step. It was done because of two people mainly, although a lady by the name of Ann Oxfeld and Deborah Richter, who is a doctor. They educated the public, informed, agitated, represented, talked to the representatives. And when Governor, I think Shumlin is the governor, Democratic governor came into power, he signed the first time in America in a bill for single payer. By the way, I heard that when Vermont joined the Union, it was the first state to abolish slavery in the country. So it's the little engine that could. So it's all in the hands of the people. We want a government by the people, of the people, that can bring health care for all the people. Now, if I did not bring God in an atheist convention, I will not be deserving of a talk here. I was shocked when I saw this in an American Association of Neurological Surgeons meeting where Jesus Christ was blessing a surgeon. I said, what the heck was that? I said, none of my neurosurgery books I saw, when you have a complicated aneurysm, pray to Jesus Christ first. It is shocking to see this kind of nonsense, but it's a reflection that just because somebody is a good neurosurgeon doesn't automatically mean, or a good scientist by profession doesn't automatically mean they're scientists by principles and philosophy. And by the way, I saw this. I said, I got to end with this. To get health care, you got to pray, buy ammo to get rid of Obama. Voting, I don't know. You can pray all you want for universal health care. Nothing will happen until we as citizens decide we got to bring it about through voting process. Thank you very much.
I'm one of those lucky Americans with Medicare.
Very good.
Before I go further, I want to thank you for really an excellent talk.
Oh, thank you. Thank you. Thank you.
You mentioned about the drug companies preventing negotiations to get drugs at a lower price. The flip side of that seems to be, I have a Health Alliance plan insurance. Mm-hmm. I can go to a hospital and I see the bill from the hospital and it will be $3,000. HAP will say we'll pay $300, mm-hmm. and so the hospital settles for $300. Mm-hmm. The poor guy who doesn't have medical insurance apparently is not only going to have to pay for it himself, but he's going to have to pay 10 times over
Absolutely.
what it cost me. So he is in effect subsidizing me with my insurance.
Yeah.
I wonder what can be done about that.
Yeah, absolutely. You know, see, this is such a complicated topic. My film has a segment that absolutely talks about what you're talking about. This book I showed you by Patrick Rooney and Dan Perrin called America's Healthcare Crisis Solved. One of the first chapters it says, as I said, problem is greed. Those guys are just amazing how they just railed into hospitals, how they make unbelievable amount of money from uninsured population. Mm-hmm. And what happens is exactly what you said. So insurance companies negotiate with the hospital how much they'll pay for, say, appendectomy, right? Say $2,000. But the charge is $10,000. Now, there's no law against, as long as you charge equal to everybody, but negotiate it separately how much you're going to accept, it's not illegal. But the uninsured patient does not know that there is a pre-agreed payment schedule because he doesn't know or she doesn't know. In California, they're now trying to bring a law that says everybody should publish their agreed upon payment schedules with all the insurance companies, which I think is an awesome thing if it happens. If it doesn't, there is a lady called Billing Lady. Just Google her, billinglady.com. This is what she does. If you have a problem and you were billed $30,000, you go to her and she says, you know, first thing I want you to do is get itemized billing account of the whole thing. And in that you will know that some of the hospitals have duplicated the charges. They have erroneously charged for more than what they have delivered, which is illegal, but they get away with it unless somebody catches it. And then what she does is that she negotiates. So this story of the guy that I showed in my film, who was a landscaper by accident. I mean, he had an accident and the chainsaw cut 6 of his tendons in his forearm, and he got billed $42,000. He used the billing lady, and it came down to $7,000. So awareness is very important, and eventually, that's what I meant by hospital is a middleman that's making unbelievable amount of money. Not only they're doing all these things, they're getting away with not-for-profit status, so they're not paying taxes. They're not paying taxes for their property taxes. And there are no shareholders because most of the money is leveraged by the community to build the hospital. So the CEO walks away with millions of dollars. Mm-hmm. So, I mean, it's a shame that it is continued because we're not aware and we don't bring the change. Yes, but that's a problem.
You identified 3 problems with the American medical system. I think it was cost, quality, and availability. Cost got a lot of attention, as it well deserves, and it probably has a capability of sinking the system. And you identified a lot of the problems where cost gets increased. What I don't understand is whose ox is going to get gored. If if we're going to find a way to take cost out of the medical system, that means somebody's going to get less than they're getting. And it's not at all clear to me how that's going to happen or who it's going to happen to. Do you have any?
Yeah. So, in other words, what's the solution for the problem? So, ideally, a single payer is the best system. Because if you have a single payer, what it'll do is that it'll eliminate the insurance companies, period. Non-Medicare population, private insurance is highly, highly expensive. Every year it went up, the premiums went up. In fact, that Angela Brady, who was the WellPoint CEO, at one time in 2010 told California that we're going to raise your premiums by 39%, period. Well, how? Why? No. So the insurance company, whatever the executive branch of the government of California, took action. I said, wait a minute, we need information why you're doing this. So apparently they realized erroneously the numbers were, by mistake, different than what they intended to. They said, no, not going to cut it, come back with different numbers. So 2 years later. So with a single payer, that will be eliminated.
How is that eliminated? The government will arbitrarily assign.
So what it will
fees to
do,
doctors?
through single payer, what it will do is that right now, let's say that I'm paying payroll taxes, right? So part of that money goes to Medicare. So all the necessary expense comes from taxes, absolutely allocated only to health care. That's the first thing. It doesn't go to an insurance company to deliver care. And then either, like in England, lots of the hospitals are government run, which, Americans may find it difficult to accept. It can be publicly funded but privately delivered, like in Sweden. So in Sweden, the spine surgeon operates, he gets paid by the government. It doesn't matter which part of the country he goes to, it is the same price. But the private companies are the ones that run this to effectively maximize whatever. So if they pay $1,000, the government says, I'll pay you $1,000. I don't care how you deliver it, but you have to have certain quality parameters met. So these private clinics that run these surgery centers, they make money in that fixed ceiling. So they're not going to have unregulated. So the medical devices, there's going to be regulation about how much money you can charge. You're not going to be charging as well as doctors. Everybody will be affected. But it is a dialogue between the population and the government and the doctors, which doesn't exist right now. And pharmaceuticals is the same thing. By the way, Sweden, this idea that if you have a so-called socialized medicine or a non-capitalistic system, there won't be research is not true. Majority of the basic science research in pharmaceuticals is not done by pharmaceuticals. It's done by the government, National Institute of Health and Human Services, or the universities, right? They benefit from that. Most of the money that the pharmaceuticals pay, they pay for clinical trials. And even that now, you know what they're doing? We're going to cut some money on this expense, and we're going to outsource this into third world countries, and that's where they do the clinical trials now. So all this will be avoided. Now in Sweden, majority of the research is done by the government, and that provides the guidelines for all these people. So it's not an easy fix, but there are countries that are doing this. So we just have to either, we can say, well, we don't want to reinvent the wheel, or we can say, well, we like that wheel, but we don't like it exactly the way, we're going to modify it a little bit. But that can be done, but you got to have the intention to do it. So, but to answer your question, every player, yes, will have some of their incomes come down.
And who decides how much each player, it's hard for me to envision. Is the government going to be the arbitrator and say, okay, we're going to eliminate insurance companies, that saves us some money. We're going to cut the doctor's fees by 50%. I don't know, whatever.
So to answer you practically the question, let me give you an example of Sweden. In Sweden, there are county councils that are responsible for delivering health care. They are run as the arbiters or the middlemen, as far as the administration of this, between the government and the doctors. So those members are directly elected by the public.
But that's not within Obamacare.
No. Obamacare is not comparison to Sweden. I'm asking.
But we're talking about Obamacare.
Well, Obamacare, what it will do is that it will decrease the Medicare expense. Because what it's saying is that, for example, it took, this thing that they said, Romney and Ryan said, $760 billion will be taken out of Medicare. All the senior citizens should be up in arms about Obamacare. No, what they're saying is that was the money given to private insurance companies to what's called Medicare Advantage plans to effectively run the system, but they never really realized profits or savings because of effectiveness. So they're going to take that money back. That's the first thing. The second thing is they're going to tell the hospitals, you know what? If you had a patient that had an infection and was sent away without treating it properly and he came back or she came back within 30 days, we're not going to pay for it. Right?
Yeah,
now,
and that's one issue.
yeah, so there are
that-
lots of
that
different
will
things.
work.
And then the doctors is the same thing. We're not going to pay for fee for service. The so-called accountable care organizations, there are around 15 in the country, or 30 in the country that are now in the beginning stages of implementation to see how effective they're going to be. But there, the principle is to decrease the cost by avoiding unnecessary interventions and keeping them through prevention and healthy lifestyle. So there are lots of details in this, but the intention is to bring the cost down. Now, they do not do anything to the private insurance companies other than telling them you can spend more than 15% to 20% as administrative costs, because a lot of the money was going as profits. So that's by the government. That for the first time has resulted in many private insurance companies sending checks back to a lot of people. I heard that. I said, whoa, I didn't get it from Blue Cross Blue Shield. I didn't, but they have because of Obamacare. And also it says you can say no to people who have pre-existing conditions. You can drop their coverage limitations. This is the first step, our first few steps in bringing a change. Obamacare will not be able to really control all the private insurance, device manufacturer, pharmaceutical expenses. To do that, the doctors have to take a lot more lead, the citizens have to take a lot more lead and change the system. With the Obamacare system, it improves the access a little bit, decreases the Medicare costs a little bit, but I don't think it will have tremendous effect on decreasing the premiums of private insurance companies until the costs are brought about.
I want to thank Dr. Palavali again, or we know Ms. Vivek.